A successful knee replacement is a masterclass in biomechanics. A precisely placed titanium hinge can restore mobility and keep you moving smoothly for decades. But there is a widespread assumption that this surgery is standardized. Many patients believe that if they walk into any hospital, any available orthopedic surgeon will deliver the exact same result. The data shows a different reality. The single most reliable predictor of how natural your knee feels and how long it lasts is how many times your surgeon performs this specific procedure every year. Achieving perfect mechanical alignment is a skill honed through sheer repetition. This graph tracks a surgeon's annual knee replacements against the risk of complications. Notice the sharp spike on the left. Surgeons performing fewer than 50 replacements a year consistently show higher rates of complications. But as we move into this optimized zone, between 50 and 100 procedures annually, the revision rates drop significantly and patient satisfaction peaks. High-volume surgeons simply produce better, more consistent outcomes. If you need a new knee, you might feel like a passive passenger in a massive medical system. Many patients don't even realize they have the right to choose who operates on them. You can take the default path, accepting the first assigned hospital and hoping for the best. Or you can take an optimized path, actively researching to secure a specialist with a proven track record. To demystify this process, we draw from a comprehensive guide by The Best of Health, the UK's trusted resource for over 50s navigating healthcare decisions. However, passive acceptance in healthcare carries a significant amount of risk. Actively curating your medical team is the clearest way to put the statistical odds of a successful surgery in your favor. Vetting a medical professional can feel intimidating. Fortunately, you don't need a medical degree to check a surgeon's track record. The data is publicly available. The baseline step is verifying their qualifications. A quick search of the General Medical Council Register confirms the doctor holds a current license with no restrictions and is officially listed as a specialist in trauma and orthopedic surgery. The true vetting tool, however, is the National Joint Registry. Since 2003, this database has recorded over 1 million knee replacement procedures across the UK. When you pull up a surgeon's registry profile, focus on this scorecard detailing annual volume, preferred implant, and revision rate. The revision rate is your primary indicator. A rate at or below the national average is a major green flag. While higher rates don't automatically mean poor skill, as top specialists handle complex cases, it remains a critical data point. Navigating these clinical portals certainly takes time, but putting in that effort replaces blind trust with objective confirmation. The Best of Health research team compiled this guidance directly from the General Medical Council and National Joint Registry outcome data, so you are looking at the exact same performance metrics the industry uses. A reassuring bedside manner is comforting, but objective registry data proves a surgeon actually possesses the mechanical skill to fix your knee. Your path forward depends on funding. On the NHS, your right to choose lets your GP refer you to a different hospital trust to bypass local wait lists. Selecting a trust with high-performing teams increases the odds of top-tier supervision, though the NHS cannot guarantee a specific named surgeon. Conversely, the private branch offers absolute control. You select your consultant by name for continuous care, but bear the vetting responsibility to verify the hospital's CQC rating and intensive care capabilities. Neither pathway is a passive experience. Both require you to proactively pull the right levers to optimize your care. Paying privately buys continuity and direct choice, but an informed NHS patient can still engineer a highly successful outcome by strategically selecting their hospital trust. The final hurdle is the preoperative consultation. This face-to-face meeting is your opportunity to verify the data you've researched and assess how the surgeon actually approaches your case. This matrix outlines your consultation checklist. First, ask for their annual volume and personal revision rates. Next, ask if they consider alternatives like physiotherapy before jumping to surgery. Finally, ask directly who will perform the operation and raise any concerns. You also need to watch for behavioral warnings that suggest you should seek a second opinion. Be cautious if a surgeon is defensive or reluctant when you ask to see their National Joint Registry outcomes. Pay attention to how they communicate. If they seem rushed or dismissive of your questions regarding physiotherapy and recovery time, that is a clear red flag. For private patients, remember your leverage. You are paying a fee for this initial consultation, but you are not committed to proceed. Treat it like interviewing a contractor for a high-stakes job. You don't have to make this decision alone. For more in-depth guides on checking credentials, comparing hospital prices, and making confident health decisions over 50, visit The Best of Health at thebestofhealth.co.uk. A highly skilled surgeon welcomes an informed patient. Doing this upfront research is exactly how you secure decades of confident, pain-free mobility.